My name is Jim Ulrich. I'm the president and CEO of Community Hospital in McCook, Nebraska. Here at Community Hospital, we are very dedicated to quality of care.
Well, the philosophy of quality of care here at Community Hospital, patient education is very key.
We do always try to look at the patient themselves and what their needs are, and kind of really focus on them.
We're extremely dedicated to quality, and it's really evident in our overall journey to excellence. It's in a constant journey to excellence, so that is one that we're continually striving to improve.
The community paramedicine program, I guess the first time I've heard about anything like this was, we were talking about different things that could reduce 30-day readmissions. And a home health nurse actually first brought it up.
A couple of us had been to different conferences and heard about this innovative idea that they were doing in other areas of the country. And so we went to the fire chief and talked to him about it. And he was also hearing about it on his side, and he was thrilled that we asked about it. And so that's really how it got started.
As the fire department as a whole, it's nice to help the hospital because they do so much for us. So we figured it'd be something to help take care of them too. Help them to decrease the recidivism or readmission rates.
When we first met, we kind of talked about focusing on patients that might have more of a need, patients with congestive heart failure, pneumonia, COPD. As social workers, we assess if home health or the paramedicine program might be the more appropriate choice. Then we visit with the patient, do some education with them, and talk to our physicians to see if they feel that it's appropriate as well.
Sending the EMS professionals into the home after they've left the ER, and they're more often than not invited into their houses and say, how are you following up on your discharge instructions, or how are you doing? Let's take some of your vitals to see how you're doing on your health. And if they can proactively keep that up, at the same time developing relationships with those EMS professionals, and they begin to view the healthcare community as on their side. And they're partners in their healthcare, and you know what? We really care.
On that first visit, we'll go in, we'll introduce ourselves, get to know them a little bit better, do a medical assessment on them, lung sounds, weight, blood pressure, height. And then we will go through their medication reconciliation that the doctor had ordered, make sure they have those medications at the house. And it's been very interesting to get in and actually spend a little more than 15, 20, 30 minutes taking care of a patient. You actually get to know them a little bit more, know a little bit more of their history,
The clinic side is benefiting from that coordination that we're seeing out in the community with the paramedics going out and seeing those patients. There might be a patient that they're thinking would benefit from a nursing home or a assisted living, and the patient might not feel that. And by having this referral and a paramedic go into the home and actually look at the safety aspects, they can either work with them on what they need to change, or let the doctor know how it truly is in the home.
Anytime you have a way to have partnership in your community between your healthcare entities, that is great for your community.
If you've got everything in place with education, our paramedics going out into the home and reiterating those things, because so much is thrown at you when you first come into the hospital, and when that day of discharge, all of that fits together and is going to help prevent 30-day readmissions.
The community paramedicine program overall, I would say, is just one of those examples we want to branch into further. What can we do more proactively as Community Hospital, as a part of our whole healthcare community?
I just think it's such a great opportunity to reach out to our patients and make sure that they have that safety and education that they need after they leave the hospital.
I think it's just, again, going to gain momentum, and we're going to be seen as a partner in their healthcare, not just the providers.